So when it comes to toxoplasmosis, how is it transmitted? It's transmitted through the consumption of oocytes that are normally present within feces. So there are three ways you can normally pick up these, and that's through eating uncooked meat when there's cysts in the meat, or a pregnant woman who handles cat litter, so feces that have these oocytes, or transplacental transmission of the oocytes. What is important to note is that in how it presents is that in immunocompromise, you tend to have brain abscesses, and these are described as ring-enhancing lesions on a CT or an MRI. You also can have encephalitis. There's also an encephalitis that's caused by a CNS lymphoma, and how to differentiate between toxoencephalitis and CNS lymphoma encephalitis is to do a brain biopsy. Again, the transmission, one of the ways is through cysts in meat, and this can cause, again, brain lesions, encephalitis, so forth. Now, another way is congenital, where you have, it's part of the torch infection. So congenital transplacental transmission is part of the torch infection. How does this present? You have a triad of brain calcification, hydrocephalus, and chorioretinitis. So brain calcifications, that's also, remember, that was seen in EBV. You can have hydrocephalus and seizures, which is characteristic, and you can have chorioretinitis, which is a red and inflamed looking retina in the eye. Okay. An extra symptom that is also seen is deafness, and this is normally seen within a child. Now, when you do diagnosis, how do you diagnose it? You can do two. You can do serology or biopsy. And biopsy, you're basically going intramuscular looking for a cyst. How do you treat it? You treat it with sulfadiazine or pyrimethamine. And there's a note on prophylaxis. In an HIV patient which CD4 is less than 100 and is positive for an IgG of toxoplasma, you'd want to prophylax with sulfadiazine or pyrimethamine.